Away coup plot accusations. Today, he welcomed news that the waiting list has fallen slightly in England, declaring the NHS now on the road to recovery. That may surprise the 54,000 people who waited more than 12 hours in A&E before being admitted last month, a record number for October. And the resident doctors striking for 5 days from tomorrow will only add to the pain, as our health and social care editor Victoria MacDonald now reports.
A pretty average day, they told us, at Salisbury Hospital. A suspected stroke patient was 20 minutes away.
What's your ETA? All right, we'll get a resource bed ready for you.
After her arrival, we watched 2 more ambulances, offloading patients in quick succession.
We're already quite full, so we're not starting from a brilliant baseline. As I said, we're in an escalation area already, and there's a few major cubicles available for us to offload ambulances, but this is sort of how we live now, on that knife edge of coping and operating, but it doesn't take much for us to be massively over capacity, and unfortunately that confers risk.
And the patient in the corridor, she'd been there for about 20 hours, but actually didn't seem to mind.
I'm fine here, yeah.
You don't mind?
No, I don't mind. I don't mind. It's nice and quiet and I can get my beauty sleep, yeah.
Still, they are always watching the board.
For within half an hour of each other arriving is going to put us under a little bit of pressure. You can see them stack up quite quickly. It's changing as we talk. But like I say, the hospital is in a good position and the department is in a good position. So we will be able to accommodate that at the moment.
And what's happening here in Salisbury is indeed a reflection of the decidedly mixed picture nationally, seen in today's NHS England monthly figures.
The government could be forgiven for looking for some good news wherever they can find it. So today it was the fall in waiting lists after 3 months of consecutive increases. But even ministers themselves say that this is a background against winter pressures, which some have described as a blizzard coming down the line.
Some of the most startling figures are for 12-hour trolley waits. That's the number of patients waiting for a bed after a doctor has decided they need to be admitted. In October 2011, this happened to 42 people across England. 8 years later, it had risen to more than 700. This October saw more than 54,000 people waiting 12 hours or more for a bed. That's a 25% rise compared to the year before this government took office. And this was the busiest October on record for A&Es, but now there are also warnings about the flu season, and tomorrow resident doctors go on strike again for 5 days, which the Health Secretary was keener to talk about than his relationship with Downing Street.
But the worst thing is that because they're choosing to take this course, there will be disruption for patients. This is going to put pressure on other NHS staff, and there's enough to cope with winter coming too. So this is the wrong tactic at the wrong time, and I urge the BMA to think again.
In the meantime, hospitals have been told to maintain 95% of elective care during the strike.
Well, we're getting quite good at it now, so there is a well-worn plan. And we've learnt from previous episodes of what works, what doesn't work. In essence, it's identifying key critical shifts, identifying who is around and working your best to ensure that can be covered, and then a sensible discussion about the needs of the patient first, what we can cover using the staff that we have.
There was no sign by this evening of last-minute talks, with the BMA saying hospitals need to be realistic about planning for safe patient care. Yet it is fair to say that in all acute hospitals now, the tipping point is never far away. They're building a new urgent care unit to help with the A&E pressures here, but it won't be finished until next year. So for the winter ahead, every space in ED is needed.